Hi, it's Dr. Andres again. So who should be screened for colorectal cancer? The American Cancer Society recommends that all adults begin their routine screenings at the age of 45. Yes, 45. This is a new recommendation that's come up in the last few years due to the rise in early colon cancer diagnoses, with 1 in 5 diagnoses occurring in patients who are between the ages of 20 and 55. You may even need screenings before the age of 45 if you have certain risk factors for colon cancer. You may be at higher risk if you have a family history of colon cancer or colon polyps, if there are certain genetic conditions in your family, if you're African American, or if you have a history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis. Now here's Dr. Thorngren to talk a little bit more about when to screen, colonoscopies, and other forms of colon cancer screenings.
Hello, I'm Dr. Frank Thorngren. I've been here in Hettinger now for 20 plus years, and have had the opportunity to do quite a few colonoscopies during that time. March is Colon Cancer Awareness Month, and we're trying to provide some encouragement and education concerning colon cancer and colonoscopy, because colonoscopy is probably not on the top of your wish list, but is an essential part of preventive medical care. And depending on the results, if everything's normal, then they don't have to have another colonoscopy for 10 years intervals. If there are polyps or some other abnormalities, it may be more frequent. And of course, if there's something worrisome, the sooner that is caught and taken care of, the better the results. If people have symptoms such as blood in the stool, painful bowel movements, chronic diarrhea, unexplained abdominal pain, these things shouldn't be ignored, and colonoscopy is often part of the evaluation. You can't ignore these things and have things progressing to a point where it's more difficult to intervene and take care of. So if you have blood in the stool, you need to discuss that with your healthcare provider and not just slough it off as a minor inconvenience and some hemorrhoids or something like that, and miss an opportunity to intervene early in a potentially serious problem. Our prep for colonoscopy is much kinder and gentler than it used to be. A one-day prep makes it really quite simple, and you don't have to drink a gallon of a prep. You just take Gatorade and Miralax and some Dulcolax tablets, and that gets things moving and gets you cleaned out for a successful colonoscopy in most cases. So it's prep is still not a pleasant deal, and kind of screws up that day before, so you probably don't want to do it at Easter or Thanksgiving, but it's not an uncomfortable or painful thing. So I just want to encourage people to have colon cancer screening. If the test for blood in the stool is positive, or if one of the other commercial preparations is positive, like Cologuard, then the next step in the evaluation is a colonoscopy. There are things on the horizon like virtual colonoscopy and other things you may have heard about, but they don't take the place of being able to see exactly what's going on and what's there and get a sample. So colonoscopy is still the gold standard.